What's up, TUMNAD lectures? In this video, we are going to go into the detail of what we call the cardiac cycle. If you find this video helpful at the end of it, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now, in the previous video, we looked at the basics of what we call the cardiac cycle. We said that the cardiac cycle is going to be those kind of the mechanical events that are going to be occurring within one heartbeat, and which was taking approximately 0.8 seconds. Okay, and we said that cardiac cycle is going to be occurring in mainly 4 phases. We said that the first one was mid to late ventricular diastole or mid to late ventricular relaxation. The second one was what we call isovolumetric ventricular contraction. The third one was what we call mid to late ventricular contraction, and then the last one was what we call isovolumetric ventricular relaxation. Okay, in this video we are going to go ahead and see the events which are going to be happening in each one of those phases. Let's go ahead and get started. So we are taking a look on the first phase of the cardiac cycle, which we are calling the mid to late ventricular diastole, the last kind of the ends of what we call the ventricular relaxation. Now, so during the start of this phase, our main kind of the focus or the variables we're going to be paying much attention is going to be what we call, we shall mainly focus on what we call the arterial pressure changes versus what we call ventricular pressure. We shall also look on what we call ventricular pressure versus arterial pressure. We shall also look on the status of what we call the AV valves and what we call the semilunar valve. We shall also look on what we call the ventricular blood volume changes. And then finally, we shall talk on what we call the ECG wave patterns, okay? Because we said that this cardiac cycle also moves in line with what we call the heart conduction system, okay? So now, these are going to be what we call our AV valves, and these are going to be what we call the aortic semilunar valve and what we call the pulmonary semilunar valve. Now, when I talk of what we call arterial pressure, I'm going to be mainly focusing on the process generated whenever blood enters into what we call the pulmonary circulation, or even when it enters into what we call the aorta. Okay, we shall have to compare it with what we call the ventricular pressures. Okay. Now, during this kind of the phase we are calling the mid to late ventricular diastole, something is so much important is going to be happening. Now, during this phase, we are going to be having blood coming within into what we call the atria. And this blood is going to be coming from what we call the pulmonary veins, which is going to be coming from the lungs into the left atrium. We're also going to be having blood coming to the right atrium through what we call the inferior vena cava, superior vena cava, and what we call the coronary sinus. This blood is going to be accumulating inside what we call the atria. Now, the pressures within the atria are going to be starting to rise. And once it rises, it's going to be now forcing these kind of the AV valves to open. Why? Because now the pressure within the atria is going to be greater than the pressure within the ventricles. That one will cause the AV valves to open. Okay, so now we are seeing that the AV valves and this blood is going to be coming to what we call the ventricles, meaning that during this phase the ventricles are going to be filling up with the blood. For that reason, this mid to late ventricular diastole can also be called a phase of ventricular filling. Okay, so now I can even also call it as a phase. We can also call it a phase of ventricular, what we call a phase of ventricular filling. Okay, it is during this phase that we are going to be having our ventricles filling up with the blood. Okay, so now blood is going to be starting to accumulate. It's going to be starting to accumulate within what we call the ventricles. Okay, and of course, something which is so much important is that when this kind of the AV valves open, they're going to be allowing 70 to 80% of the blood coming from what we call to the atria, and that is going to be passive. Okay, that doesn't require any kind of what we call atrial contraction. Okay, now towards the end of what we call ventricular relaxation, this is when we're going to be having our SA node spontaneously repolarizing, sending all those kind of reaction potential that are going to be spread throughout the entire kind of the myocardium of the atria, causing them to contract, and they push the remaining 20% of the blood into the ventricles. Okay, so now it means that we are going to be having what we call atrial contraction to push the remaining 20%, which is going to be topping up the volume of the blood into what we call the ventricles. So now at this time we're going to be having now what we call the end diastolic volume. Okay, which is the volume of the blood in the ventricles before they contract, or when they are still in the relaxed form. Okay. Now, something which is so much beautiful is that the ventricular pressure at this time is still going to be less as compared to what we call the arterial pressure. Okay, so now let's put that one in writing. we have said that the arterial pressure is going to be greater than the ventricular pressure. Okay, we are seeing that the arterial pressure is going to be still greater than the ventricular, is going to be greater than what you call ventricular pressure. And because of that, our AV valves are going to be opening. Okay, we shall see our AV valves going to be opening. And we have said that the pressures within the ventricle is going to be still less as compared to the pressure within the arterial system. Okay, or we can even write it and say that the arterial pressure is still going to be greater than what we call ventricular pressure. And because of that, our semilunar valve are going to be staying closed. Okay, are going to be staying closed. Now, what's going to be happening on the ventricular blood volume? Because this is the phase of ventricular filling, it means they're going to be increasing blood volume. Okay, so you shall have what we call increase. Okay, you shall have increase in what we call a ventricular blood volume. Now, what's going to be happening on what we call the ECG wave? Because on the late end of what we call ventricular relaxation, we are having the SA node releasing the kind of reaction potentials that was depolarizing the entire artery of myocardium, causing what we call contraction. So now we expect to see what we call a P wave. Okay, so we shall expect to see what we call the P wave on what we call the ECG machine. Okay, so now that briefly covers what we call mid to late ventricular diastole. So now let's go to the second phase, which we are calling the isovolumetric ventricular contraction. Okay, so now we are looking on the second phase of the cardiac cycle, which we are calling the isovolumetric ventricular systole, what we call ventricular contraction. So now during this phase, now our ventricles are going to be slowly depolarizing and they are now going to be starting to contract. Okay, so now as they contract, they are going to be now pushing this blood start moving and moving and moving and moving a bit up. Okay, so now as they contract, they are going to be now moving this blood up to approximately this level. Okay, as they continue to push and push and push and push, they are generally going to be pushing this blood and it comes around this level. Okay, meaning that during this time there is going to be an extensive amount of what we call the ventricular pressure. The pressures generated within what we call the ventricles at this point is going to be greater than the pressures in what we call the atria. Now, what's going to be the status of what we call the AV valves? The AV valves are going to be closing. Okay, so now we shall expect our AV valves to be closing. So now the pressure which is going to be at this time, which is going to be within the ventricles, generally it's going to be around 60 millimeters of mercury for the case of the left ventricle, and then for the right ventricle it can be generally it is going to be a low pressure system around 5 millimeters of mercury. Okay, and of course at this time within the atria it's going to be approximately around 0. So now how about within what we call the arterial system? Now naturally within the arterial system we are going to be having the pressure which is going to be at this time is going to be around 80 millimeters of mercury. That's for the case of the aorta. And then for the case of what we call the pulmonary system, it's not going to be a bit somehow high. It's going to be generally around 10. Okay, it's going to be generally around 10 millimeters of mercury. Now, when you see the pressure changes within these different areas, you realize that the pressures within the ventricles is going to be higher than the pressures within the atria. But the pressures within the arterial system is going to be greater than the pressures within the ventricles, meaning that we shall have our aortic semilunar valve and pulmonary semilunar valve still closed. Okay, and we shall also have what we call the closure of what we call AV valves. And during this time, there is not going to be any kind of the blood leaving what we call the ventricle, meaning that there is going to be no change in the ventricular blood volume. Okay, so now you're going to be having no change. You're going to be having no change in what we call ventricular blood volume, meaning that the ventricles are going to be contracting in a closed chamber. Nothing is going to be moving out during isovolumetric ventricular contraction. Okay, so now we have said that the arterial pressure is going to be less compared to what we call ventricular pressure, but still we can write it as ventricular pressure. We can write it as ventricular pressure is going to be greater than what we call arterial pressure, and because of that, our AV valves are going to be closed. Okay, our AV valves are going to be closed, and of course we have said that the arterial pressure is going to be still greater than what we call the ventricular pressure. Okay, so now our arterial pressure is still going to be greater than what we call ventricular pressure. And because of that, our semilunar valve are going to be staying closed. Okay. So now, when you see the AV valves are going to be closing because of the higher ventricular pressure than the arterial pressure, it will make the AV valves to close. And this kind of the closure of what you call the AV valves will give us a beautiful kind of the sound, which you call the S1 as what we call the lab. So we are going to be expecting to hear our S1 sound, which we call the lab. It is also such another beautiful thing. So now, what is going to be happening on what we call our kind of the ECG wave? We see that our ventricles are depolarizing slowly and they are contracting. We expect to see a QRS wave complex. Okay, we expect to see what we call a QRS wave complex. That is something which we expect to see on what we call on the ECG paper. Okay, it is also such another beautiful thing. Now that we have seen the second phase, let's go ahead and see the third phase, which is going to be what we call the mid to late ventricular contraction. Okay, so we are taking a look on what we call the mid to late ventricular contraction. What's going to be happening on this phase? Still, we are going to be following the same kind of the variable throughout the entire study of what we call the cardiac cycle. So now during this phase, now the ventricles are now going to be contracting and they squeeze the blood very, very, very much strongly, meaning that during this phase, we are going to be experiencing an extensive amount of what we call pressures within what we call the ventricles. Now, what's going to be happening? Now, all the entire ventricular myocardium is going to be now completely depolarized, and then it squeezes the blood as if it has never squeezed before to eject the blood off into what we call the aortic system and what we call the pulmonary system. Meaning that during this phase, we are going to be having now the highest systolic peak that the ventricle can generate. And on average, the left ventricle can generate approximately 120 millimeters of mercury. And then for the case of the right side of the heart, which is a low system, can generate approximately around 25 millimeters of mercury. Okay. Now you are seeing that during this phase, the ventricular pressure is becoming super very high to an extent that it is even greater than what we call the arterial pressure. Okay, and even also it is greater than what we call the arterial pressure, meaning that our kind of the AV valves are also going to be staying closed, but this time around, our kind of the semilunar valve are now going to be beautifully opening. Okay, because the ventricular pressure is going to be higher than what we call the arterial pressure. Okay, and because of that, our blood is going to be now ejected off the aorta and what we call the pulmonary system. It means the ventricular blood volume is going to be decreasing. So we shall expect what we call a decrease. We shall expect what we call a decrease in ventricular blood volume. Okay, the fact that the blood is going to be leaving the ventricles, this mid-late ventricular systole can also be called what we call ejection phase. Okay, it can also be called ventricular ejection phase, because it is during this phase that the blood is going to be leaving what we call the ventricles. It is such another beautiful thing. So now we have seen that ventricular pressure is going to be greater than the arterial pressure. Okay, ventricular pressure, ventricular pressure is going to be greater than what we call the arterial pressure. And because of that, this time around, our semilunar valve are going to be open. They are going to be opening. And we said that the ventricular pressure is still greater than the arterial pressure, and for that reason, our AV valves are also going to be staying, closed, because our ventricular pressure, is still greater than what we call the arterial pressure. Okay, that is something which is so much beautiful. Now, the question is, what is going to be happening on what we call the ECG pattern? Something which is so much beautiful is that we are going to be having two things going to be happening within the ECG machine. First of all, the ventricles are going to be contracting strongly as if they've never contracted before, and that one is noted as what we call the QRS wave complex. But the fact that the entire ventricular myocardium is going to be reaching now its maximum depolarization potential, it means we are going to be having the entire ventricular myocardium fully depolarized, and the ECG pointer will be coming back to the neutral, which will give us what we call the ST segment. Meaning that during this phase, we are going to be having our QRS wave complex, and also we shall have what we call an isoelectric line, which denotes what we call the ST segment, meaning that the entire ventricular myocardium is fully depolarized and it has contracted to push the blood off into what we call the aorta and what we call the pulmonary system. Okay, so now that briefly covers what we call the third phase of the cardiac cycle, which we call the mid to late ventricular contraction. Now let's go ahead and look on the fourth phase of the cardiac cycle, which we call the isovolumetric ventricular relaxation. So now we are taking on the last phase of the cardiac cycle, which we are calling the isovolumetric ventricular diastole. Okay, so now what is going to be happening? Again, still we are moving with the same variable, which is going to be the arterial pressure versus ventricular pressure versus arterial pressure, AV valve status, seminal valve status, and the ventricular blood volume, and also comment on what we call the ECG. Now, what's going to be happening at this phase? This blood now is in what we call the aorta and what we call the pulmonary system, meaning that you're going to be having an extensive amount of the pressures generated within what we call the aorta and even also in what we call the pulmonary system. Now, at this time, because the pressure is too much within these areas, blood will try to first come back into the ventricles because the pressures here are going to be higher than the pressures within what we call the ventricles. Okay, and because this kind of the aorta is so much elastic, there is going to be a temporary brief in an increase in pressures within what we call the aorta, which we call the dichrotic notch. Okay, so now what we are seeing is that the pressures within the aorta and the pressures within the pulmonary circuit is going to be higher than the pressures within what we call the ventricles. Now, what does that one mean? It means that our kind of the seminal valve are going to be closing again. And the reason why they're going to be closing again is that we don't want this blood from this kind of the aorta to flow back into the left ventricle, and we don't want the blood from what we call the pulmonary arteries to flow back into what we call the right ventricle. We don't want that. Okay, so now what's going to be happening? It means that the arterial pressure is now greater than the ventricular pressure. Okay, we have what we call the arterial pressure. The arterial pressure is going to be greater than what we call ventricular pressure. And because of that, our kind of aortic seminal valve and then pulmonary seminal valve are going to be closing. Okay? And again, there is going to be a very abrupt reduction in the blood pressures within the ventricle. At this time, still the pressures in the ventricle is still higher than the pressures in what we call the artery. It means that even at this time, the AV valves are also going to be still closed. Okay, they are also going to be still closed. Okay. Now the question is, at this time, what's going to be the ventricular blood volume changes? Do we expect any kind of the ventricular blood volume? There is not going to be change in the ventricular blood volume. So now there is no change. There is no change in what we call ventricular blood volume. There is nothing coming back, and there is nothing which is going to be leaving during the isovolumetric ventricular relaxation. Okay, and of course we have said that the ventricular pressure is going also still greater than what we call the arterial pressure. Okay, still ventricular pressure still ventricular pressure is still greater than what we call arterial. And because of that, our AV valves are going to be staying closed. And now, during this kind of the phase, we are also going to be hearing our second beautiful kind of the sound, which we call the S2, which we term as what we call the dub. Okay, so now you're going to be hearing our kind of the S2 sound, which we call the dub. Okay, so now we're hearing the second hard sound, which we are calling the dub. So now that's why you're going to be hearing the lab dub. Lab dub. Those are the two hard sounds that are commonly heard on what we call using different kind of what we call the stethoscope. Okay. Now that we have seen that, what's going to be the wave pattern on what we call on the ECG machine now? Because the ventricles are now relaxing. Now, we say that the ventricles are undergoing what we call a repolarization phase. And of course, when we say ventricles are undergoing a repolarization phase, our ECG machine is going to be giving us a positive deflection, which we call the T wave. Okay, so now we expect to see what we call a T wave. Okay, so now we expect to see what we call a T wave. So now that's why we said that the cardiac cycle is going to be in line with what we call the heart conduction system, which can also be illustrated by what we call the ECG machine. And of course, we have said that this one is going to be taking approximately 0.8 seconds, which is the normal time taken by what we call the cardiac cycle. To finish it all, we said that the ventricles are relaxing. So now they are going to be relaxing as the pressure drops and drops and drops and drops. If the pressure drops less than the pressures within the atria, it means now we are now going to be entering what we call the first phase of what we call the cardiac cycle, which we said the mid-to-late ventricular diastole, where we are going to be having the AV valves opening as the blood moves back into what we call the ventricles. And of course, this is going to be a recycling process, and that's why we call it the cardiac cycle. Okay, thank you very much for watching, and if you think whatever I've talked is making sense, is adding to you or benefiting, please can hit that like button, comment down in the comment section, and please subscribe. As always, TUMNAD, until we meet next time.